Hi, my name is Caitlin. I'm a level 2 nursing student, and today I'm just going to be doing a bit of a crash course on subcutaneous and intramuscular injections. Before giving any type of medication, it's important that you check the MAR to ensure that the patient doesn't have any allergies to the medication or any past history of any adverse reactions that could happen with the medication. It's also important to go over the 8 rights of medication before administering anything. Doesn't matter if it's subcutaneous, intramuscular, or even oral medications. It's important to always check those 8 rights, which are the right person, medication, time, dose, route, position, documentation, and the patient's right to refuse. All of these things can be found in the MAR, and when identifying the right person, it's important to always check 3 different identifiers when giving them the medication. You always can do this by checking their wristband, by asking them to verbally give you their name or their date of birth, along with checking the MAR to make sure that it's the right patient. The last part, which might not be included in the 8 rights, but I still think it's important, is the right reaction. It's always important that after giving any type of medication to a patient that you come back within 15 minutes and always checking to make sure that the medication is working effectively and isn't causing any adverse reactions. So next in the injection process is picking your right syringe and needle. Because I'm going to be doing an intramuscular and a subcutaneous injection, I have 2 needles. Our first needle, we have a 23 gauge needle, and it's 1 inch. This would be used for an intramuscular injection because intramuscular injections require a needle that is 25 gauges or lower, and that or 1 inch or longer, because you're trying to get through deeper muscle layers, unlike subcutaneous needles, which would be like this one here, which is a 25 gauge needle and 5/8 of an inch. So it's going to be smaller because we're not going as deep into the patient. It's also important to note that the larger the gauge is also going to make the lumen of the needle smaller. I have assessed the patient's weight and body size, and it is appropriate for their age and gender. So that's why we are going to be using these needles today. If we had an obese patient, then we would want to give them maybe a longer needle just so that it gets through their adipose tissue. Okay, so next up, we're going to perform hand hygiene because it's always important to perform hand hygiene in any state when you're touching anything to do with the patient or any medication administration. Next, I'm just going to be demonstrating for subcutaneous at the moment, but you want to take the package and make sure that it hasn't been opened previously and it's brand new. And also you want to have your medication with you. Typically there would be a cap that you'd have to pop off to make sure that it hasn't been used before, because this is a single-use vial, so it means it would have to get discarded after we used it, but for instructional purposes we're not going to do that. It's also important that you make sure that you have medication that isn't expired. In this case it is expired, but it's okay. We're going to do it for educational purposes. I don't think that the injection pad or the dummy is going to mind. So next what you're going to do is you're going to open up the needle, and you're going to be sterilizing the top of the vial that you're going to be using and discarding all the garbage in a garbage bin that should be close to you. It's important to have everything that you need very close to you just to minimize any type of errors that could happen. So next what you're going to do is you're going to check the MAR and ensure that you're giving the right amount of medication. In this case, for my patient, they need 1 milliliter of sodium chloride. So what I'm going to do is I'm going to open up the needle with my arms at a 90-degree angle and pulling away from me. And then what I'm going to do is I'm going to draw up the amount of medication that I would need, in this case 1 milliliter, in air, because I'm going to be injecting that into the vial to create positive pressure. So it's important that you are taking the medication up slowly to try and ensure that you don't get air bubbles, but eventually it is inevitable that you do get some type of air bubbles. As you can see, it's forming at the top right there. You want to make sure that the top part of the plunger is at the 1 milliliter line in this case. So there are some air bubbles, as you can see, right at the bottom and at the top. So what you can do is you can take your pen and just hit them all the way up, as you can see, and we still have that air bubble at the top, so You see, because of hitting it with your pen, you can hit it with your finger, but I just find it easier with the pen just so that you don't hurt yourself. As you can see, there are no air bubbles at all here. And what I'm going to do is I'm going to take the needle out of this medication vial on the table and then recap it. It's important when you're recapping that you do it against a hard surface so that you're not at risk for any needle poke injuries. It's also important that at this stage I would label the needle with the patient's name and other information about the medication that I will be giving, because I am going to be transferring it from this location to the bedside. So next what I'm going to do is I'm going to do the same thing for the intramuscular injection needle. I also checked the MAR, and surprisingly, you also need 1 milliliter of sodium chloride, which just happens to be here, the expired sodium chloride. And we are going to do the exact same process as we did before as a subcutaneous needle. So because I've already explained it, I'm not going to be going through this in as great of detail, but I will still be using the appropriate technique. So again, making sure that you're opening up the needle and you've performed your hand hygiene. And then also making sure that the package was not opened before. Next, make sure that you have the correct medication. I'll clean the top of the vial just to make sure that you're not transmitting any bacteria at all. Medication, opening up with your elbows at a 90-degree angle and pulling away from you. Again, we need 1 milliliter of the medication, so we are going to be drawing that medication amount up in air. So next what we're going to do is we're going to take the needle and we're going to push it down a 90-degree angle into the vial and inject that air that we took up. So again, positive pressure. You're going to hold the needle in an appropriate position, making sure that you're not going to bend it at all. And you're going to take that 1 milliliter of medication of the expired sodium chloride. And again, I have some air bubbles, so I'm just going to hit them out with my pen. And it is okay to push some of the air at the top of your needle back into the vial and then redraw out the correct amount. Again, ensuring there's no air bubbles, placing it down at the counter, taking the needle out and making sure that you are not recapping it with the ends of your fingers. You are putting it against a hard surface and then clicking it on, and then labeling the medication to transfer it to the bedside. So before coming into the room with your patient, it's always important to do hand hygiene. I am going to just do it right here just for your purpose of knowing that I did do it and I'm not lying to you. And also ensuring that you have proper gloves on. So in this case, I'm going to be putting these ones on right here. It's important to make sure that you have all your supplies close to you before giving any medications, just to reduce any risk of error or anything else like that. Next, what you want to do is you want to confirm the patient identification and explain the procedure to them. So this is my patient from the MAR. It's supposed to be Dwight. So can I just get your name, please?
Dwight Schur.
Perfect. And can I get your date of birth?
May 5th, 1975.
Perfect. And I'm also going to check your wristband, which also confirms out of all of my 3 patient identification factors. Next I'm going to do, Dwight, is the doctor has ordered for you to get 1 milliliter of sodium chloride injection. And I'm going to be doing intramuscular and a subcutaneous injection today. So the first, I'm going to start with their subcutaneous injection. Do you have any questions before we get started?
No.
Okay, perfect. So I'm first going to be doing the subcutaneous injection in the stomach area, abdomen area of the patient. I have checked the patient's stomach and I've made sure that there is no issues with skin integrity, any rashes, lesions, anything that would make the medication administration go wrong. And so what you're going to do is you're going to landmark and you're going to give a subcutaneous injection 1 to 2 inches away from the umbilicus. And when you're giving the subcutaneous injection, it's important that you do it at a 45 to 90 degree angle, depending on the patient's muscle mass, body build, etc. So for our patient, we can see that they, again, as I explained before, are appropriate weight and are pretty lean for their age and gender. Okay, Dwight, so what I'm going to do is I'm now going to be cleaning the area before giving you the injection. So I would clean the stomach, but just for educational purposes, I'm going to be doing my subcutaneous injection on the injection pad. So it's important that you start in the center of the area where you want to inject and go in a circular motion outwards. And also wait before for the alcohol to dry, just to make sure that that's not going to affect our medication administration. Okay, Dwight, so next what I'm going to do is I'm going to be opening the needle at a 90-degree angle with my arms pointing outwards. And I am now going to just make sure that I am injecting it at a 45 to 90-degree angle. And injecting the medication slowly. And then pulling out. And then the next thing you want to do, again, have a hard surface to do your needle recapping with. And disposing this in the appropriate location, which is going to be the Sharps band located right over here. Okay, so next I'm going to do is the IM medication administration. Again, it's going to be 1 milliliter of sodium chloride. Dwight, I hope that you're okay with that. I know that you're getting poked a lot today, so so next what you're going to do is I'm going to just get you to lay on your side for me. It's important when giving an intramuscular injection that you do your landmarking appropriate, and when you're giving the needle that you're giving it at a 90-degree angle. Again, just like before, I would have done my patient identifiers, checking the 3 patient identifiers, and also making sure that the patient knows the 8 rights of medication administration, along with the right to refuse any medication that was given, and as well as documenting after I finished giving the medication. So for landmarking, I'm going to stick the palm of my hand on the greater trochanter, and then I'm going to be sticking my thumb towards the groin area and my middle finger towards the gluteal area, and along with keeping my index finger on the top of the iliac spine. It gives us a little triangular area right here where we can inject the IM injection. We do this landmarking to make sure that we don't hit the vagus nerve, and we would want to inject into the part right here. And again, for educational purposes, we're going to be using our injection pad. So what I'm going to do again is take out my alcohol wipe and start in the center of the place where I like to inject and do a circular motion outwards. And discard of that. Wait for the alcohol to dry, which could take a minute. Yeah. So now that the alcohol is dry, what I'm going to do is I'm going to be performing the Z technique while giving the IM injection, just to go over that quickly right before I do it. We do the Z technique, which is going like this and beside the area where you would want to give the injection, which would be here, and then releasing after you give the injection. This is just so that we don't have any medication leak up from the muscles, and just to ensure that we give it appropriately. So what I'm going to do is, again, uncap my medication, and Dwight, this is going to be going in right into the spot where we landmarked before. I'm just going to be pinching it right here, and we're going to go in at a 90-degree angle straight downwards and let go, and slowly administer the medication and pull out. Again, what you would want to do is recapping, put it against a hard surface, prevent any needle stick, and taking this and sticking it into our Sharps bin. Okay, Dwight, I'm going to be checking in on you in the next 15 minutes just to make sure that the sodium chloride is working its appropriate effects on you. And if you have any questions, just let me know.